Senator Brown, and I see in the chair another strong supporter of Social Security, a distinguished senator from Massachusetts. And for colleagues who aren't aware, Senator Brown is our chair of the Subcommittee on Social Security in the Senate Finance Committee. This is a crucial subcommittee for all the reasons that Senator Brown just mentioned. And I'm just going to make a couple of points, and if my colleague is still on the floor, maybe we can have a little bit of a colloquy. What Senator Brown, pardon me?
Without objection.
Thank you. What Senator Brown has illustrated, again, is the differences between the two parties on Social Security and Medicare. And my colleague was kind enough to go back to my past as co-director of the Oregon Gray Panthers. And ever since those days, the difference between the two parties has been that on our side of the aisle, we're very blunt when we get asked about Social Security and Medicare. As Senator Brown just said, on our side, we make it clear that Social Security and Medicare are a guarantee. They're not a voucher. They're not something that's going to be thrown to the private market. They are a guarantee. What we hear from our colleagues on the other side is sort of a word salad, but it nearly always involves a statement about how much they want to protect Social Security, but then we hear a lot about privatization, about portability, about investment. It's anything but what you just heard Senator Brown say, that Medicare and Social Security are not something to be privatized. They're about a guarantee. And we should make no mistake about it. Seniors, others who are eligible for the programs have earned these benefits. They have earned these benefits. And yet, somehow our colleagues on the other side of the aisle and candidates don't get what the programs are really all about. For example, not long ago, I saw a Republican Senate candidate out west say in a primary forum, Congress ought to, quote, privatize Social Security and just get the government out of it. Just get the government out of it. Now, apparently he's the nominee, and he's for protecting Social Security. Swears up and down he's for protecting Social Security. Huge about face. Heard another Westerner asked on live TV about his thoughts on Social Security. And he said nothing about a guarantee. He said we ought to look at portability issues and individual accounts and benefit cuts are on the menu. Again, this is kind of Washington lingo, Washington code for unraveling the guarantee that is Social Security and Medicare that I learned about in those days when I was co-director of the Oregon Gray Panthers. And Americans don't want their elected representatives to cut this crucial set of programs that are earned benefits. And they certainly don't want their elected officials and candidates to talk about both sides of their mouth. Now, I mentioned this question of Westerners and where Westerners stand, but apparently this opposition to these core principles of Social Security doesn't just reside in the West. It seems to have spread across the country. Senator Rick Scott has proposed ending, again, the guarantees of these bedrock programs, Social Security and Medicare, and just sunsetting them after just a few years. Sunsetting them. So as I would say to my colleague who's worked with me on a lot of these issues, let's just unpack that for a minute. We believe that Social Security and Medicare are guarantees. They're not subject to these annual political kind of battles and pushed and prodded for political advantage. They're guarantees. But yet, after quoting those in the West who want to come join us, now we have a Southerner in a position of great importance who wants to sunset programs like Social Security and Medicare after just a few years, and in effect throw them to the winds to see what kind of politics might be put in place. I don't believe that's acceptable. Senator Brown, the chair of our subcommittee, doesn't believe that's acceptable. Social Security is among the most foundational principles in our country's history, providing financial security through guaranteed benefits for millions of Americans. Over 70 million Americans receive Social Security and supplemental security income every year. Over.
Would the Senator yield for one moment?
I would be happy and particularly so that you can tell everybody again why you feel so strongly.
Well, I'd like to ask you, you had said that Senator Scott, who's the chairman of the Republican Senate Campaign Committee, represents the third largest state in the country, Florida. He said he wants to sunset. What exactly, just explain that so my colleagues understand. Yeah. The word sunset doesn't sound so bad until you really explain it. And Senator Markey, I know, understands it, but explain that if you would.
Yeah.
As the chair of the committee.
What sunset means is you would unravel the basic principles of Social Security and Medicare. We don't subject them to annual or regular political fights. We've said people have earned those benefits. And we aren't just going to set arbitrary dates and say we're going to, in effect, move on and we'll decide what happens to seniors and disabled based on the politics of the moment. It is a 180-degree departure from the kind of guarantee that you spelled out that I feel so strongly about. We don't say we're just going to have these arbitrary changes that could put at risk the entire program.
So he's saying, then, if I understand this right, Senator Wyden, Senator Scott, again, the chair of the Republican Senate Campaign Committee, representing the third largest state in the country, he's saying if every 5 years, if the Senate doesn't say yes to Social Security and Medicare, then they're unraveled, then they die. It's up to the Senate to say yes every 5 years?
My colleague from Ohio is being way too logical, because you bet. What this essentially means is if you sunset it, the program and the benefits are not going to continue as they have. And as you said, if people decide because of some particular kind of flurry at the moment, of some cause they don't want to continue it, the well-being and security of seniors is a job.
So if there's a president in a Senate and a House in 5 years that wants to privatize Medicare and end Social Security, they just block this, or a president wants to veto it, or a Senate leader like Senator McConnell that's never really believed in it, they can do nothing. They just do nuts. It's up to people who support Social Security and Medicare to keep it going every 5 years, in other words. The burden's on the supporters, the public, those who, which is to me 90% of the public or more likes this. So that's the way it works, right?
You have stated it well. It would mean that when you sunset it, you have to have a brand new fight to reestablish its primacy as a guarantee. You sunset it.
Well, and go back with that. You said a brand new fight. I'm not an historian. I like reading history, but I know enough about Medicare, because I care a lot about the history, as you do, of that, and Senator Markey and others, and Senator Leahy's on the floor about it too, that President Truman wanted to enact Medicare, but he couldn't get the Congress to do it. And then President Kennedy wanted to enact Medicare, and he couldn't get Congress to do it. It probably took the Kennedy assassination and all that was happening to sort of light a fire under Congress to pass Medicare. So you would need that kind of political will. In other words, it took almost 20 years to pass Medicare. So if Medicare were to expire, you would need a huge public wave with elected officials that want to do it to get it back in effect.
No question about it, and it would put in jeopardy fundamental core principles that seniors all across the country in Ohio and Oregon and Massachusetts have been able to count on. When you sunset it, you say you can't count on it. You have to wait for another political battle. And I would just say to my colleagues, showing how extreme the position is of our colleague from Florida, Senator Scott, Senator Orrin Hatch, the late Senator Hatch, who worked with us, when he was in the Senate, he said, we'll update the Medicare guarantee to start covering chronic care. This is something the senator from Massachusetts has worked with me on, home care for seniors. So Senator Orrin Hatch, not exactly our late colleague and my personal friend, was not exactly a liberal. He understood what you and I are talking about, that Medicare and Social Security are a guarantee. And when we talked about chronic care, he said, we're going to update the Medicare guarantee. Nothing about saying, well, gee, maybe we'll do something after we sunset it. So my colleague has said it well.
Let me ask another question. So if Senator Scott gets his way and Senator McConnell, the Republican leader, gets his way, and all those new candidates that Senator Scott is helping get elected to the Senate, if they get their way and pass Senator Scott's bill to sunset, would Senator Scott still have government health care and a government pension?
He hasn't talked about it, but I think that would certainly be one of the questions our constituents would ask about, because this issue of there being a double standard between seniors at home and their elected officials would be very real. He hadn't spelled out how he would deal with this, but certainly the question of elected officials, because we have these retirement benefits that have been part, again, of a program that's been established for some time. They haven't been talked about. But I'll tell you, I think, as chair of the Social Security Subcommittee, and myself on the Finance Committee, we're going to go out there and say no double standard. You can be sure of that. If something is sunsetted for working people and seniors and disabled, we are certainly not going to let Senator Scott pretend that somehow it's business as usual for elected officials. Mr. President, I think Senator Brown started us off very well, and he's asking questions that I think millions of Americans are going to ask. My understanding is that my colleague from Ohio, as chairman of the subcommittee, is going to be looking at a lot of these issues in his subcommittee, but certainly this last point about politicians talking out of both sides of their mouth and saying somehow we're going to have a program sunsetted for seniors and the disabled, Social Security, Medicare, and others, but we're not going to even talk about what happens for elected officials, is an example of how you shouldn't legislate. It's an example of what I believe could be a double standard. And I'll just close, unless Senator Brown wants to. In fact, I want to let Senator Brown do it. I thought, as I listened to Senator Brown, and I put it in the context of all these years with the Gray Panthers, everybody can understand what Senator Brown is talking about. Medicare and Social Security are a guarantee, period, inviolate, as a result of the history that we had in this country where people worked so hard for this. On the other side, we're talking about privatization, we're talking about portability, we're talking about lots of new cost analyses in the private sector and individualized programs. I'm for individualized programs on top of Social Security, not in place of it. So I really appreciate your resolution, Senator Brown, and I'm going to do everything I can to support it.
Thank you, Senator Wyden.